Knock knock.
Hey Kayla,
Hey Gary.
how's it going?
Good, how are you today?
Good. What's up?
I'm just wondering if there's any way that we can manage pain without the use of drugs after a motor vehicle accident.
Okay, did the patient ask that?
Yeah, many.
Okay, so Kayla is asking me, what are the ways we can manage pain without taking drugs after motor vehicle accident? We're going to discuss that in this video. Non-pharmacological management of your pain after motor vehicle accident or whiplash injuries. Number one, when you go see your doctor after your accident, he's going to examine you, he's going to prescribe you some anti-inflammatories and painkillers. That's usually the first line of defense from the doctor's office. There is nothing wrong in that at all. But you got to pay some caution when you're taking anti-inflammatories. Why? Because do you know that inflammation is the first stage of healing? Yep, I repeat that again. Inflammation is the first stage of healing. So you don't want to stop the inflammation completely, bombarding with anti-inflammatories into your system. You want inflammation to happen a little bit so that the next stage of healing can happen. You want all the cells to come to the site of injury to take care of that. Take precautions and don't bombard yourself with anti-inflammatories and also painkillers as you need it. And you're also going to learn in this video what are the different ways of managing pain without taking those drugs, which is not a great friend of your guts. Yeah. Number one, pain education. Pain neuroscience education is very important for the patient to manage pain. First of all, you just met with an accident, you have a lot of pain, spasm, your car is in the garage, you can't go to work, you're working with insurance companies, multiple phone calls, then you're dealing with your no car and you have to depend on somebody else to drive or arranging the rental vehicles. You might be dropping kids and picking up kids from school. Now who's going to drop the kids? Who's going to pick up the kids? Then you are in pain. Are you taking a day off or not? There's so many things going on after motor vehicle accidents. I've been personally in 2 or 3 accidents myself, so I know what are the stresses you have to go through after a motor vehicle accident, right? So you need education about your pain, why you have pain, what is giving you pain, right? Pain is more than just an injured muscle or injured joint or a ligament. It is a global thing, right? So pain changes depends on your stress, depends on your emotions, depends on what you eat, depends on your sleep or don't sleep, depends on your social circumstances, work circumstances. So many factors. Pain is a multifactorial thing. It's not just the ligament and the bone. And you are a therapist. We have to spend time on your pain neuroscience education to you so you understand, you have good clarity and direction how we're going to manage that pain as we go along in your treatment plan. Number 2, nutrition. Because poor nutrition can give you more pain, and because of pain, you're also not able to take proper nutrition. So you consult your family doctor or your dietitian and nutritionist to have a good nutrition plan. Don't skip your meals. Eat delicious, nutritious meals to take care of your healing and the pain management part of it. And also hydration is very important because dehydration can increase pain as well. So make sure you drink enough water. You don't need any special liquids, just water is good enough. And if you want, you can put a pinch of salt in it, Himalayan pink salt if you want, and then just hydrate yourself nicely and you will be just fine. That's the number 2 way to manage your pain without drugs. Number three, the big gun is your sleep. I know it is very stressful after an accident. You try to make so many phone calls, so many adjustments in your lifestyle. You have to get proper sleep, right? Sleep is your brain cleaning time. Do not forget that. Sleep is your brain cleaning time. As soon as you close your eyes, all these mates is going to rush and clean and polish your brain and take away all the abnormal proteins and keep it clean for the next day function and next day life. So how much time do you want to give for your brain to be cleaned? It's up to you. So please sleep well. That is also important part of your pain management. Number 4, social, fun. Yes, you must be asking me, are you crazy? I've just an accident. You want me to go have fun? I mean, within your limits, see what you can do. Just go out with your friends, go for dinner, go for coffee, talk to them, express your feelings and just talk it out and have people over. It's okay, have some fun. You can't reverse what happened to your car or your body, but don't stop having fun. The social aspect, meeting people in person, not online, not just here, just in person. It secretes so many beautiful neurohormones in your brain, which helps in your pain management. So, social activities and having little fun within your limits is very important for you for pain management. Number 5, complementary or adjunct or integrative wellness or therapy models. So you got to look beyond just physiotherapy, okay? Massage therapy is very good to relax your muscles for pain management without any pharmacological interventions. Tai Chi, yoga, some mindfulness practice, meditation, and just going out for a walk in the nature, good breathing, all these things are very important. Don't just think about drugs, think about all these complementary things you can do to manage your pain very well. Number 6, behavioral health approaches or psychological approaches. Because of all the stress and anxiety, and you might develop so much increased pain in your body, okay? How good is your body depends on how good your mind is, right? So those can increase your pain level as well. So consult your psychologist, talk to your counselor. Having some behavioral approach is very important. It can be either cognitive behavioral therapy or cognitive functional therapy, commitment therapy, whatever it is. Involved in that, take help for your mental health also. That will help with your pain management as well. Next one, number 7, is restorative therapy or physical therapy approaches. And you can go with hot and cold applications on the painful area, and a little bit of a soft tissue work by the therapist, a little bit of a joint mobilization or manipulation work from the therapist or a chiropractor. And also you can have some modalities, electrotherapy modalities, which can help you with the pain in terms of transcutaneous electrical nerve stimulation, which is called TENS, or some ultrasound or shockwave. Whatever is indicated for your condition depends on what stage you are at. Are you in acute stage, or subacute stage, or chronic stage, and depends on your symptoms. Your physiotherapist will determine what modality or approach would help you to relieve your pain without going into the drugs too much. Number 8, and the final way to manage your pain without pharmacology, is physical activity and exercises, okay? Do not forget that movement is medicine. Movement is also a painkiller. When you are stiff, when you move the joint, it relieves your pain by stimulating certain receptors to block your pain. So use movement as your painkiller as well. And have some unstructured playtime. Unstructured, just going out for a walk, or dog walk, or just walking around in the neighborhood. That's also, and just playing with your dog, and just a gentle cleaning in the house. Involved in your hobbies, involved in some unstructured playful activities, and incorporate physical activity through your day-to-day life. That's very important. But when you do that, you also have to remember, you have to pace yourself, right? You are injured in a car accident, your tissues are trying to heal. You have to give that rest, and you have to enhance the healing process. So you have to pace your activities. Don't take up too much on your plate. Pace yourself. When you feel you're done at 80%, you're done. You don't have to push it to 100% of empty tank, right? That's going to bring out more symptoms in you. If you're starting your day with 100% tank, you stop your day at 80% when your tank is empty. Do not push to 100% emptiness. That will bring out more symptoms, especially when you're whiplash and concussion, all those things. You don't want to kind of totally exhaust yourself. You should know when to say, I'm done for today. This is it for me. That is up to you to find that spot and stick to the spot and pace your activities. So these are the things to follow if you want to manage your pain without taking too many drugs. But I'm not saying drugs are bad, but you can also manage the other way. That's what I'm giving you these tips. If you have any questions, please give us a shout at Instep Physical Therapy, okay? And if you like this content, if you think it will help your family or friends, please share and subscribe to our online media channels, okay? Otherwise, in injury and in pain and in recovery, together we can. Bye.